Hello everyone. Today's topic is hypertensive disorder in pregnancy. At first, I'm going to read preeclampsia. What is preeclampsia? Rise of blood pressure after 20 weeks of pregnancy with proteinuria or target organ effect. What are the symptoms of preeclampsia? Advice pregnant women to see a healthcare professional immediately if they experience symptoms of preeclampsia. Symptoms include excuse me, severe headache, problems with vision such as blurring of vision or flashing before the eyes, severe pain below the ribs, severe pain, okay? Then vomiting and sudden swelling of the face, hands, or feet. Advise pregnant women at high risk of preeclampsia to take 75 milligram to 150 milligram of aspirin daily from 12 weeks until the birth of the baby. Okay, here they say according to NICE guideline, until the birth of the baby. Women at high risk are those with any of the following: hypertensive disease during a previous pregnancy, chronic kidney disease, autoimmune disease such as systemic lupus erythematosus or SLE or antiphospholipid syndrome, type 2, type 1 diabetes, and chronic hypertension. Advise pregnant women with more than one moderate risk factor for preeclampsia to take 75 milligram to 150 milligram of aspirin daily from 12 weeks until the birth of the baby. Factors indicating moderate risk are nulliparity, age 40 years or older, pregnancy interval of more than 10 years, body mass index or BMI more than 35 kg per meter square or more at first visit, family history of preeclampsia, multifetal pregnancy. Okay, again I am saying that high risk factors are hypertensive disease during a previous pregnancy, chronic kidney disease, type 1 or type 2 diabetes, autoimmune disease such as SLE or antiphospholipid antibody syndrome, and chronic hypertension. And moderate risk one moderate risk factor of preeclampsia, that is nulliparity, more than 40 years, pregnancy interval of more than 10 years, BMI more than 35 kg per meter square or more at first visit, family history of preeclampsia, and multifetal pregnancy. High risk factor is preeclampsia in previous pregnancy, and moderate risk is family history of preeclampsia. Okay. So moderate risk factor includes parity, age, weight, family history, and number of pregnancy. Then other pharmaceutical agents: do not use the following to prevent hypertensive disorders during pregnancy. Do not use nitric oxide donors, progesterone, diuretics, low molecular weight heparin to prevent hypertensive disorder during pregnancy. Okay. Nutritional supplement: do not recommend the following supplements solely with the aim of preventing hypertensive disorders during pregnancy: magnesium, folic acid, antioxidant, vitamin A, C, vitamin C, E, fish oils or algal oils, garlic. Do not recommend salt restriction during pregnancy solely to prevent gestational hypertension or preeclampsia. Lifestyle: give the same advice on rest, exercise, and work to women with chronic hypertension or at risk of hypertensive disorders during pregnancy as healthy pregnant women. Now, assessment of proteinuria in hypertensive disorders of pregnancy. Interpret proteinuria measurement for pregnant women in the context of a full clinical review of symptoms, signs, and other investigations for preeclampsia. Use an automated reagent strip reading device for dipstick screening for proteinuria in pregnant women in secondary care setting. If dipstick screening is positive, 1 plus or more, use albumin creatinine ratio or protein creatinine ratio to quantify proteinuria in pregnant women. So, if we found dipstick urine 1 plus or more, then we will give albumin creatinine ratio or protein creatinine ratio to quantify proteinuria in pregnant women. Do not use first morning urine void to quantify proteinuria in pregnant women. Do not routinely use 24-hour urine collection to quantify proteinuria in pregnant women. If using protein creatinine ratio to quantify proteinuria in pregnant women, use 30 mg per millimole as a threshold for significant proteinuria. If the result is 30 mg per millimole or above, and there is still uncertainty about the diagnosis of preeclampsia, consider retesting on a new sample alongside clinical review. So, protein creatinine ratio threshold level is 30 mg per millimole to quantify proteinuria in pregnant women. If using albumin creatinine ratio as an alternative to protein creatinine ratio to diagnose preeclampsia in pregnant women with hypertension, the threshold level is 8 mg per millimole. If the result is 8 mg per millimole or above and there is still uncertainty about the diagnosis of preeclampsia, consider retesting on a new sample alongside clinical review. Now, management of chronic hypertension in pregnancy. Pre-pregnancy advice. In preconceptional counseling, offer women with chronic hypertension referral to a specialist in hypertensive disorders of pregnancy to discuss the risks and benefits of treatment. Advise women who take angiotensin converting enzyme or AC inhibitors or angiotensin 2 receptor blockers that there is an increased risk of congenital anomalies if these drugs are taken during pregnancy. To discuss alternative antihypertensive treatment with the healthcare professional responsible for managing their hypertension if they are planning pregnancy. So, if in preconceptional counseling any woman is taking an AC inhibitor or angiotensin 2 receptor blocker, then after pregnancy, it should be changed into labetalol or nifedipine or alpha-methyl-dopa. To discuss alternative treatment with the healthcare professional responsible for managing their